So Dr. Grant, this is actually a really good topic and something that I'm very proud of is that, in Michigan, Blue Cross Blue Shield has become a real leader in urologic care and innovations through its partnership with music. Music is a collaborative that was formed and started basically from the University of Michigan, and now almost all of the urologists in the state of Michigan in some way have partnered with this organization. And what music does is it helps us analyze what we do and how to improve what we do and make it better for our patients, such as diagnosing prostate cancer. The first program was how to reduce biopsy sepsis or infections during the biopsy itself. And subsequently, now we've added in stone disease. So what do you see as the future of music? And do you think that this will become a model for states all across the United States? And how will this actually benefit physician providers and patients alike?
That's a great question, Michael. And you know what? The beauty of it is that is the one thing that I'm so proud of at Blue Cross is what we call the CQIs, the Collaborative Quality Initiatives, which there's 17 of, music being one of our shining stars. Like you said, it's really amazing. Every urologist almost, I think mine is like less than a handful, are members of music. And it doesn't matter whether you're at the university, whether you're employed by a health system, whether you're in private practice, everybody has come together to give the data to send the data to music so that we can actually take better care of patients. So if you're natural, you say, well, why does Blue Cross support it? Well, Blue Cross actually supports the collaboratives to the tune of over $200 million a year. And why do we do it? We do it because it's better healthcare. It's better for our members. It's better for the community. We have shown if doctors, if physicians, if providers can all come together to share our data, and we share it in a very blinded fashion, if we can share our data, we'll actually be able, and collaboratively, music meets 4 times a year where everyone gets together and looks at the data and looks at, why is group A have such a lower infection rate than group B? What are they doing differently so that we can take best practices to deliver better care? Because frankly, at the end of the day, better care costs less money. Better care means that an infected patient doesn't come to the emergency room, doesn't come to, for extra procedures, doesn't come with complications needing extra drugs. If we can invest in quality healthcare, we can actually not only deliver a better product, we can deliver a better product for less money. So when I actually came to Blue Cross from Los Angeles, I was in Los Angeles for the past couple of years. And when I told everyone I was leaving to go to work for Blue Cross Blue Shield, they'd say, oh my God, you're going to the dark side. You're going to an insurance company. And then every now and then someone would pop up and say, no, Blue Cross Blue Shield in Michigan's a little different. Blue Cross Blue Shield in Michigan supports better healthcare. They actually support doctors getting together to talk about issues, regardless of their background. And there's nothing I can say that we're so proud of the work that comes out of all of our 17 CQIs. And actually, we're on our way to forming 2 more CQIs, one for diabetes, because we know the effects diabetes has, and one with lower back pain, because these are, again, they're our first 2 that aren't involving a procedure, but because if you look at the amount of diabetes we have in the state and the amount of lower back pain, if we can get together on best practices on that, think of the great work that's happened with music. Think of the great work that's happened with Aspire. Think of the great work that's happened with the surgical collaboratives. We can actually just take it to the next level and continue to be a national leader. Other Blues have actually looked at us. And I've actually gone and talked, and I got to give so much of the credit to Tom Zimmer, my predecessor, and David Scher. It was their brainchild with someone named Tom Lydon, who you've probably all heard of. Tom Lydon lives and breathes the CQIs. He's not a physician, but he's our staff that runs the CQIs, and he's passionate about doing the right thing for patients.
Well, I know that you have great staff at BCBSM because, one of our board members of our foundation, as we talked about earlier, Bill Plies, is on our foundation board, and he offers all kinds of resources and knowledge to our foundation as a result of his presence. And we've worked with Blue Cross's social media people to understand a little bit more about the complexities of social media and how to get our message of men's health advocacy into the community. And so you've been a great partner with us. And I think that this music program has been a great boon for our practice and improving the way we can give care to our patients and reduce complications and improve outcomes. So I think that as a physician and as a consumer of healthcare, I'm on both sides of the coin, and I've appreciated both aspects of it.